This video is for education only and isn't medical advice. If you have kidney disease, diabetes, heart disease, or take medicines like insulin, blood pressure pills, or phosphate binders, talk to your clinician or a renal dietitian before changing your diet. With that said, let's set the record straight. Your kidneys work all day and all night, but a single snack won't flush them or drop creatinine fast. Serum creatinine mostly reflects kidney filtration and muscle metabolism. Food doesn't magically lower it overnight. What smart evening choices can do is reduce sodium and phosphate additive exposure, keep potassium and fluids in a safe range for your stage of CKD, support stable blood sugar, and increase the kind of fiber that helps bind gut-derived uremic toxins. Those upstream wins can lighten the nightly load on your kidneys so you wake up feeling steadier and protect kidney function over time. Start by reframing what a bedtime snack should be when kidneys are struggling. We want low sodium to avoid overnight fluid retention and blood pressure spikes, an appropriate potassium load for your lab values and CKD stage. Minimal phosphate additives because they're rapidly absorbed and drive vascular and bone complications. Modest, low to moderate carbs that don't cause a glucose surge. Small, plant-forward protein if you need it, but not heavy animal protein right before sleep. And ideally, soluble and fermentable fibers that help trap nitrogenous wastes and reduce the production and reabsorption of toxins like indoxyl sulfate in the gut. Keep portions small. Think snack, not second dinner. And keep timing gentle, about 30 to 60 minutes before bed so reflux and fullness don't disturb sleep, because good sleep itself improves blood pressure, appetite hormones, and glucose control the next day. With that frame, let's build an evening routine around kidney-smart options. Unsweetened applesauce is a simple place to start. Pick a brand with only apples on the ingredient list. No added sugar, no sodium benzoate, no potassium sorbate, no phos additives. A modest portion, half a cup to 1 cup, gives you soft, easy-to-digest carbohydrate with a little soluble fiber, especially pectin. That fiber helps slow glucose absorption and can bind some gut toxins that otherwise contribute to the overall uremic burden. It's gentle if you have poor appetite late in the day, and it won't load you with potassium the way a very large serving of certain fruits might. If you enjoy a dusting of ground cinnamon, that's fine for most people. Keep it light, especially if you have liver issues, and avoid pre-made spiced cups that add sugar or salt. The goal is calm, not a dessert. If you crave something crisp and hydrating, cucumber sticks, plain, raw, and unsalted, can be refreshing without throwing sodium, phosphorus, or calories at your kidneys. Because cucumbers are mostly water and low in potassium per small serving, they can help you feel satisfied with very little metabolic cost. A small bowl, about half to 1 cup of sticks, works well 30 to 60 minutes before bed. Skip pickled versions and salty dips. The whole point is a sodium-light crunch. If you like acid, a squeeze of lemon is okay in tiny amounts, but avoid salt and potassium-enriched salt substitutes unless your clinician says they're safe for you. Some people want a little bit of protein at night to avoid waking up hungry. A classic pairing is celery with a small side of hummus. Celery brings water and fiber with very few calories. Hummus, in a 2 tablespoon serving, adds a gentle amount of plant protein and unsaturated fat. The caution here is salt and phosphorus additives. Many commercial dips are loaded with both. Look for a low-sodium hummus without phos ingredients on the label, or make a quick version at home with cooked chickpeas, lemon, garlic, and olive oil, seasoning with herbs instead of salt. Keep celery portions modest if your potassium is high and your clinician has you on a restriction, and keep hummus to a couple of tablespoons so you're not converting a snack into a meal. For a light, grain-based option, plain, unsalted rice cakes can be a useful vehicle when you want a small, predictable carbohydrate serving without a lot of potassium or phosphorus additives. Choose unflavored cakes and read labels. No cheddar, barbecue, or caramel, because those flavors often hide sodium and phosphate salts. 1 cake with a thin smear of unsweetened apple puree or a teaspoon of low-sodium hummus can take the edge off hunger without a sugar spike. If you're managing diabetes as well as CKD, Pair your rice cake with a little fiber or a few cucumber sticks, so the overall glycemic impact stays gentle. Sliced apples sprinkled with a pinch of cinnamon make a reassuring evening ritual for many people. An average apple provides fiber, including some soluble fiber, along with polyphenols that support vascular health. If your potassium is significantly restricted, check with your dietitian about fruit portions. Healthy doesn't always equal unlimited in late-stage CKD. For most people with earlier stage disease and normal potassium, half to one small apple is a reasonable bedtime snack. Keep it fresh, not canned or syrupy. The point is to avoid added sugar and salts. The cinnamon adds aroma and a sense of dessert without turning the snack into one. Air-popped popcorn is another surprise ally when it's truly plain. 1 to 3 cups of air-popped kernels, not drenched in butter, cheese powder, or salt, offers a whole grain crunch with a bit of fiber. Avoid microwave popcorn bags with butter flavor, salty seasonings, or shelf-stable cheese, which often bring heavy sodium and phosphate additives. If you want flavor, toss your popcorn with dried herbs, a hint of garlic powder if sodium isn't a strict issue for you, or a pinch of cinnamon for a sweet vibe. Just don't add salt at night if blood pressure and fluid balance are concerns. Chew well, sip fluids thoughtfully, and stop before you feel bloated. Overeating any crunchy food right before bed can disturb sleep. Finally, if you like a crackery bite, small portions of unsalted pretzels can fit for some patients. The key is truly unsalted and modest amounts, an ounce or less. Regular pretzels are often sodium bombs. That's exactly what we're trying to avoid at bedtime. Because pretzels are refined carbohydrate, they're not a nightly staple for diabetes control, but in a small dose they can tame hunger without adding potassium, calcium phosphate additives, or saturated fat. If you routinely wake up with high morning glucose, work with your diabetes clinician and dietitian on the best evening pattern for you. Some people will do better with a different balance of fiber and protein. A few practical rules make these snacks far safer and more effective. Rule 1. Sodium stealth. Read labels and assume that anything flavored, smoky, zesty, cheesy, buttery, likely brings salt. Your kidneys do better when nighttime sodium is low. Rule 2. Watch for phosphate additives that look like phos on the ingredient list. Sodium phosphate, calcium phosphate, phosphoric acid, pyrophosphate. These are absorbed much more efficiently than natural phosphorus in whole foods and are exactly what you want to minimize when kidneys are struggling. Rule 3. Personalize potassium. If your potassium is normal and you're in earlier stage CKD, if you want an easy weeknight routine to test with your care team's blessing, try this. On nights when you want sweet and soft, go with half to 1 cup of plain unsweetened applesauce and a light sprinkle of cinnamon. On nights when you want crisp and fresh, have a small bowl of cucumber sticks, plain, or paired with exactly 2 tablespoons of a low-sodium, no-additive hummus. On nights when you want crunchy comfort, choose 1 to 3 cups of air-popped, unsalted popcorn with an herb seasoning or a single plain rice cake topped with a teaspoon of unsweetened apple puree. Rotate these through the week so you don't get bored, and keep water sips modest after your snack to avoid nighttime bathroom trips that disrupt sleep. If you're on a fluid restriction, count any watery snack toward your daily allotment. The bigger picture matters just as much as the snack itself. Creatinine trends improve most reliably when blood pressure is controlled, glucose is stable, sodium and phosphate additive intake are low, protein intake matches your stage and your dietitian's plan, and you sleep enough hours with a regular schedule. An evening walk after dinner, even 10 minutes, helps glucose and blood pressure control. Turning screens off 30 minutes before bedtime improves sleep quality. Taking your prescribed meds on time, including RAAS blockers or SGLT2 inhibitors if they're part of your plan, does more for your kidneys than any one food. Your snack isn't a cure, it's one supportive brick in a wall that protects the kidneys you have. So tonight, keep it simple. Choose a small, sodium-light, additive-free, fiber-forward snack that fits your potassium plan. Read the label. Stop at satisfied, not stuffed. Then protect your sleep. Over weeks and months, not hours, you'll notice the difference in morning swelling, blood pressure readings, and energy. That's how you help your kidneys do their quiet work while you rest. If you want more kidney-smart recipes and label-reading walkthroughs, hit subscribe and tell me in the comments which of these evening options feels most doable for you right now. Your next best step isn't a gimmick. It's a calm choice you can repeat tonight and tomorrow.